Good morning, friends, and welcome to the show of Mirror Wisdom Reflected. You know what Mirror Wisdom Reflected is all about? The current problems faced by the society, the intellectuals who are there who give solutions to them. In this show, I try and act as a mirror to get the wisdom reflected from the invited guests and celebrities. The present problem, what you can see is a lot of young deaths which have happened in the society. And the famous case of actor Puneeth Rajkumar made the world really aware of what's the worst thing that can happen with heavy exercises. Exercise is a must, but what about over-exercising and not exercising? There is a thin line of demarcation, as I call it, or a Lakshman Rekha. Like in a cricket pitch, you have that line, white line. If the ball goes above that, it's a sixer and you're a hero. But if you are caught within the white line on the last ball and there are 6 runs remaining, you are a zero. So the thin line of demarcation or the Lakshman Rekha is what is broken by a lot of people many times. And we don't really come to know because it's a very, very thin line of demarcation in life. And this Lakshman Rekha could be there in any particular field. It could be in relations with people. It could be in relations with your parents, spouse, education, not there. You got to push yourself. Management will tell you to keep pushing yourself, not to stop. But how much enough is enough? Everything in moderation, including moderation, is the wise answer. But what is it? How much is it? How long should it be? What are the implications? These are something which are very important questions to be answered. You had the famous case of Christian Eriksen, the famous footballer last year who had a heart attack right on the field. A young, fit man with his team of fit people, his medical team along with him. He used to exercise well, great diet control, everything possibly going well for him. In the middle of the match, he collapses. And fortunately for him, his teammates knew exactly how to revive him, and he survived. And this is the importance of what we are going to be talking about. There is so much that is there, known, unknown, how much you can push. We unfortunately in the medical fraternity have young doctors in the past 2 months who passed away after heavy exercise. Young radiologist in Ambani Hospital in Mumbai, 45-year-old. I know because one of my patients got operated the previous evening, and the next day after a heavy workout, he had a massive attack and he passed away without even other things. There is another doctor friend of mine who runs a diagnostic chain, 55-year-old. Severe pain, middle of night, taken to the hospital, no chance of revival. Fit, remember, I'm not talking about unfit, diabetic, hypertensive, uncontrolled stuff, but people who have been fit, who've been working out, who've been doing their job regularly, taking care of their health, and what exactly happens to them. So there is this flux which has been going on, and a lot of talk always that why the sudden death. There is a etiology, there is family history, there could be smoking. But what are the factors that we can avoid, what we should be doing, whether we should be exercising? Well, to begin with, I'm a staunch believer you have to exercise. Because all those who don't want to exercise, the best excuse for them is to look, this guy was exercising and despite that he passed away and he had problems. Well, that is not the answer. That's the easiest lazy way out. How much is enough is enough. So let me tell you the advantages of having exercise, regular exercise. It prevents strokes. It prevents high blood pressure. It prevents type 2 diabetes. It helps battle depression, battle anxiety. It improves mood. It improves and boosts energy, helps us sleep better. There could be a better smile. The endorphins really work very well. And I can vouch for that because when you exercise, the feel-good factor is phenomenal. Well, all kinds of eating disorders, bowel movements, all that can be taken care of. Hormonal cycles for female. A lot of these disturbances also can work well with exercises. But well, what happens if you work out too much? Your immune system goes down. A lot of cases that we saw following the vaccine, the corona vaccine, people got corona. Well, quite often we have seen that after vaccination or otherwise, after a heavy workout for almost 72 hours plus, your immune system is suppressed. It's not elevated. And that's the time when you can have a problem. So enough is enough. How much is enough is what we're going to be discussed. So you have mild, moderate, intense depending on how much your cardiologist, your trainer tells you. Intense exercise definitely impairs our immunity. Okay, let's start with the basic. How much is enough? How to calculate what is your maximum heart rate? The standard formula given is 220 minus your age, approximately, say it's 50 or 60, so it's 160, or third of your basic heart rate is what you're looking at. In a normal workout, if your heart rate is between 60 to 100, you're allowed to go between 60 to 80% maximum of your heart rate. It's important that you don't overdo it. Vigorous workout can increase your heart rate from 70 to 85%. And an intense workout can increase from 80 to 95%. So eat right, work out, stay fit. And what the doctors are saying is what we're going to listen. That our bodies are not machines. There's a limit to human endurance. We like to push ourselves. And yes, pushing yourself definitely helps to a limit. But human endurance has a limit and it must be respected. It's 40% physically active 2 to 4 times a week. Not much. You don't have to do it twice a day to get aggressive like a lot of people, what you read in the newspapers. 30% physically active more than 4 times a week, and 10% rarely or never did any exercise. So this is something that intense exercise more than 5 hours a week, 19% more likely to develop an irregular heartbeat. And this is a very important statement. However, on the other hand, less intense exercise, 13% less likely to develop an irregular heartbeat. How about that? So the moral of the story is training helps, straining backfires. So how much of workout is advisable? 5 hours of moderate exercise per week, depending on whichever type of exercises that you want. And we have some specialists who are going to tell us what kind would be the best for us. Working all major muscle groups and developing your core very strong. An athlete's heart. And yes, of course, you have so many fitness coaches and fitness influencers now on YouTube who push you to no limit without really knowing what your condition was, never having examined you, never looking at your cardiac profile or your lipid profile or your blood profile. And as a result of which, there has been a lot of misguidance during the COVID endemic when everybody went online to get their exercises. So personal transformation or gym is not equal to certification. We have to be careful on that. And our basics have to be clear because exercise is mandatory, but there are people I know who are exercise addicted. You don't really want to do that. Working out regularly is not equal to exercise addiction. You must work out. And signs of what are the exercise addiction? Feeling anxious, exhausted after missing a workout. Well, friends, let's get 2 very prominent different people from different fields. One, a very dear friend of mine, Dr. Akshay Mehta, a famous cardiologist practicing at Jew and Nanavati Hospital, very senior in interventional cardiology. He's got a lovely book to his name also called He's a romantic guy. So, he's got a book called Romancing the Heart. And that book, I will put it up on that. It's a very nice book that he's written down. Being a romantic guy, he said how we can romance with our heart. How can we control the heartbeats? And what is it that you need to know about the show? Thank you, Dr. Akshay Mehta, for sparing your valuable time and coming for this show this morning.
Thank you. Thank you, Himanshu.
I think we have with us a very famous duo from the exercise field with treating a lot of celebrities, doing a great work on Pilates. Samir has been himself had injuries in younger days, but he was determined that he's going to be doing well on his own. He has been supplying equipments to a lot of gyms across the country. He knows exactly which muscle is acting when, what kind of exercises are good for you, how to start, what to do. And of course, you have the celebrity daughter who is one of the 40 most influential female today, which has been donated by Forbes. And that's no small deal. She's been a great influencer. She has who's who of the Bollywood working out with her, a fit young lady, absolutely addicted, enjoying her job. And what a pair it is, the father-daughter duo, who make a lot of people fit.
Thank you.
We're going to have them and ask them some tough questions on how much is it good, what kind of exercise is good, how should we go about with it, what is the right form of exercise, how much should you stress your heart, what is the importance of your core, your back, your spine. Wonderful. Thanks so much for being with us, Samir and Namrata. Thanks so much.
Thank you for having us.
Thank you.
Thank you.
In fact, if I may just add something, it's amazing to be in a company of two really leading doctors in their own field, Dr. Himanshu Mehta and of course, Dr. Akshay Mehta. I mean, it really is a pleasure and it makes us feel great. Thank you so much.
Thank you. Thank you so much. Yeah.
Akshay, to start with, let's ask you this common question, that you also agree that exercising your heart is very important, not just romantic it and increasing your pulse rate so that you can face your stressful situations properly. How about the heart rate? How often should you exercise? How much should you exercise? What is your recommendation?
Yeah. See, now the whole thing is about what is the aim of exercising. So now, if your aim of exercising is to prevent heart disease.
Can you come a little closer to the microphone, Akshay? Yeah.
Yeah. Can you hear me?
Yes.
So can you hear me now?
Yes.
Yeah. So the aim is what do you want to achieve? If you want to prevent all these risk factors like diabetes, hypertension, cholesterol, heart disease, obesity, etc., I think a regular moderate exercise is the best because it gives a lot of benefits with low risk, especially if you don't have already heart disease inherent and you've been doing it at a regular pace. You have started slow, gradually increased the intensity and kept at a moderate level, which is about 50 to 70% of your target heart rate. And the other way to know that you are doing moderate exercises, that you are just able to talk but can't sing. If a person can sing and walk, then he is very slow. So it's little brisk walking that is required. So that is moderate, and regularity is extremely important because exercise is like medicine, and it benefits you till the time you take the medicine. You stop the medicine, after 2-3 weeks, all the benefits go away. So regularity is extremely important. And at moderate level, you get all the benefits without the risk. But if you want added benefit, like you want to run a marathon, you want to reduce your risk still further of heart disease in future, then more intense exercise can give you more benefit. But that comes with a little risk. And that risk depends on a lot of factors. It depends on whether you have underlying silent coronary blockages or not. That is number one. Or whether you have congenital, since birth, defects like heart muscle being very thick, called hypertrophic cardiomyopathy, or whether you have certain electrical abnormalities in the heart since birth, which go unnoticed because they don't have symptoms, or you have abnormality inherent genetic in the coronary artery anatomy, the way they come out from the heart. So if you have inherent disease or prolonged, very intense exercise like marathons and severe exercise, triathlons, etc., sometimes we have found they've produced fibrosis in the heart muscle, and that itself in the long run could be dangerous. Many of these very intense exercises, as you also rightly mentioned, develop some arrhythmias like atrial fibrillation. So these are so on the one hand you have underlying disease of the heart, and on the other hand you have precipitating factors like not slept well or started exercise very early after COVID, recovery from COVID, or any infection. Any infection or COVID is like any infection. It creates disturbances in your system in such a way that you can be more prone to coronary thrombosis or plaque rupture and heart attacks and things like that. So I think to answer in short, I think the way to go is moderate regular exercise for most of people after, of course, a proper checkup. And intensive exercise if you want added benefits and other goals you want to achieve. But then your pre-exercise screening has to be more rigorous. That is what I would like to say. That screening is extremely important, or checkups are extremely important.
So, Dr. Akshay,
Yeah.
if somebody who's been sedentary at 45 and now realizes the importance and he wants to start exercising,
Yes.
he should get a thorough blood workup done.
Correct.
And should he be doing a plain cardiogram or a stress test also?
See, it depends. I think for people who don't have any risk factors, and if he starts gradually and he's notes his symptoms, he has no symptoms, he has no family history, no risk factors, then at least the blood workup and a cardiogram should be good enough. But if he has risk factors, even one risk factor, I would say a stress test should be done.
Correct.
And,
So
yeah.
So
And if he
ideally,
wants to do, and if he has risk factors and he wants to do marathon, for example, when he's sedentary and he suddenly now wants to do, of course, the whole thing has to be very gradual. But then sometimes I feel for selected people, even a CT angiography would be an important test, because it will tell you whatever silent blockages you have.
there is this famous case of a very dear friend of mine, a doctor friend, extremely fit, running marathons, Dr. Rakesh Sinha.
Yeah.
And while jogging in the park, he passed away. Fit
Correct.
guy, absolutely
Correct.
good control on diet, doing very well in life. And these are random cases. So, which is why I was asking you that doing a stress test once a year, should it be a good idea for patients, for people generally speaking?
Yes, it is a good idea, but for some people, we have to go more than the stress test, because stress test may miss those blockages which are less than 70%. Supposing I have 2-3 blocks which are 40% each, then my stress test will not reveal it. And one fine day, if I stress too much, that one plaque may rupture and cause a heart attack, and it comes out of the blue. And so only a CT angiography will tell us. So in some people, selected people, CT angiography, I would not recommend for all, but for selected people, I think we will have to do it, because the way we are seeing young deaths all around, it's so shocking.
It's very interesting, Dr. Akshay, because, I was under the impression, because when my father underwent a bypass, his cardiogram was normal.
Yeah.
But his stress test was bad.
Right.
And we had to get his bypass surgery done, a CABG surgery done.
Correct.
So, which is what I realized, that a plain cardiogram hardly has any significance.
Yeah.
A stress test is even better. And now you're telling me that since we have CT angio, not very difficult, highly non-interventional, it should be a good idea if you have other risk factors, because you will never come to know if your plaques are bad, because you have some fit people who suddenly have a collapse or have a heart attack. I always wonder why.
Yes. So I think we'll have to be more liberal on doing a CT angiogram, though it has its risk of radiation, injection of the dye, etc. But I think we'll have to balance the risk and benefit and do it for some people.
But exercise is a must, is what you recommend at any given point of time.
Absolutely. And you summarized it well, all the benefits. Additionally, I would like to tell that if you are a moderate exerciser on a regular basis, the other thing that is important is that your blood's capacity to dissolve clots is much better. That is number one. And the second thing is your heart rhythm. Your heart rhythm is less prone to develop arrhythmias and cardiac arrest. So these are additional benefits. And of course, on the brain, they've said Alzheimer's and Parkinson's and all those things have less chances to develop.
All right. So according to you, the least, if you can't do the least you should be doing is walking. Am I right?
Absolutely.
It's the simplest, easiest, best, and the most fit thing that one can do.
Correct.
And a great diet control.
Yes, of course. True. Yeah, I think we talk about vegetarian diet, but we eat lots of simple starch, refined starch and sugar, and some trans fats also. And those are the killers. So we'll have to.
Yes. So that was very wonderful talk last time we had with Dr. Devi Shetty, with Bhujang Shetty, who gave us excellent answers on how to reverse diabetes and the diet control. He, being a diabetic for 25 years, reversed it by simple diet control. So that's something very amazing, which is the new thing that we are learning in life. But since we have been talking about exercise, Samir, now the ball comes to you, because people will come to you absolutely trusting you And quite often I've seen that a lot of trainers don't even know what they are saying. Protein supplements, take steroids, do this, quick muscle recovery, and those lovely ads in the newspapers. Uh, don't worry, you lose 10 kilograms in 1 month. Please expand a little on that. What kind of exercise is good? Which is the exercise which should be done at what stage in life? You look into a lot of celebrities. They look very fit on screen. How fit are they? And how much hard work are they putting in?
I think basically I really believe in is safety first. I mean, we both, that's Namrata and me both. Whenever a client chooses to exercise, they must look at something which is safety first, because that is what's going to be more sustainable and more beneficial, as Dr. Mehta said, that on a long-term basis. Along with that, before really COVID set in, the guidelines given by the top education bodies in the world were very different than what the guidelines now are. So initially they said about 150 minutes of moderate exercise per week, and 75 minutes of intense exercise, not extreme. Again, I'm saying intense exercise per week is enough. Post-COVID, that is when things world started opening up, it changed to the same. The first 150 and 75 remain the same for people having sedentary lifestyle of up to 7 hours a day. But if it is more than 7 hours, then they definitely said that you should be moving a little more to maybe 300 minutes of exercise, moderate. Again, I said moderate exercise a week, and 150 minutes of, again, vigorous or intense exercise, not extreme exercise per week. So that is the whole, everything has changed. We basically, I always say that anybody who wants to train, it's always good to start slow. There's never a hurry. We have to take our own sweet time. Otherwise, as Dr. Mehta said, yes, there can be a lot of problems which can happen, especially if you start at a slightly later age. When we are young, we are 18, 19, 20, 21, 25, whatever, we feel our bodies are really unbreakable. Because we are young and you want to go ahead and do everything, but they don't realize that the moment you start crossing 35, 40, and you have been doing these extreme exercises from the age of 20, 25, your body will have already taken its toll. Silently, the body has not responded as yet, but then one day it will respond so badly that you will, if you feel fitness is tough, we always say, try injury. You know how tough is injury and coming back from injury. So it's always a question of being smart, train smart, and as my daughter says, KISS. Keep it simple, safe, and smart. So yeah, that's one of the way to begin, really. They should always take a doctor's advice before starting the routine that they want at almost any age, I say, because nowadays we find so many young people, even at the age of 25, 28, 30, getting sudden heart attack, etc., which is not necessarily underlying, but it's because of the other stress factors also which happens. So we always believe start slow, take your time, and move forward.
What is this concept of HIIT, high intensity interval training?
Well, actually, HIIT is good. I don't deny the fact it's good, but everything again in moderation. HIIT was made not with the idea of working out for 5 days or 7 days a week of doing HIIT, but HIIT idea was to work maybe twice a week and probably up to a maximum of 20 minutes, starting with 4 minutes, 8 minutes, a gradual increase. But what happens is that because of the factors that are shown, people tend to, for example, people tend to drop weight. I'm just saying hypothetically, people tend to drop weight. Then, for basically the human thing is what? I want to lose weight. But that really is not right. I mean, losing weight can be really like a double-edged sword, That's not the way to go about it.
Also, weight loss is not equal to being healthy or being fit.
Exactly.
Right? You want to also be fit. While yes, some people might have a goal of losing weight, so you might work with that. But suddenly jumping into your exercise regime and thinking, okay, if I run and run and run and run and run, I'm going to lose weight. Well, yes, you might, but you might also have other, injuries or health conditions that might creep up. So you don't want to do that. You want to start slow. And even when it comes to weight loss, think not only cardio. You don't only want to go get onto a treadmill and run and run and run. You also want to do some form of strength training, whether it's Pilates or, whether it's conventional strength training, because you also need to develop those muscles. You also need to work on the entire body, like you said earlier, the core, the importance of the core, and all those aspects to even prevent other injuries from happening. And exercise isn't just about what your target heart rate
repetitions
is,
or repetitions.
How intense it was, or the normal saying, no pain, no gain. That really isn't it anymore.
That's all the past. That's the past. I mean,
you want to realize that you can get a lot of gain with zero pain. You don't need to have any pain. So that's really what we're trying to get out there and educate people. But it's a slow process because there's still a lot of, especially people around my age, my friends, they want to go for this really intense class and they feel all of us are doing it together and we've worked so hard and, we've done, if I may say, CrossFit or whatever. And then what then? Okay, maybe you do it once a week. What about the other 5 days? You're doing that. You're just tearing more muscle fibers. You're just putting that much more load on yourself, your heart, your body, your mind even.
Your joints.
Yeah, eventually you're going to land up with problems. And I keep trying to tell my clients that this is the age for us to actually do good to our body and not harm it, because it's going to catch up with us at some point.
So build a foundation, build a strong foundation which you can sustain for the rest of your life. So it's so important. Like I've seen people do maybe 100 squats, 500 squats in one go. I mean, come on, is that the way to train? I mean, in an Indian language, मार तोड़ के तो कोई भी body बना सकता है. लेकिन जब टूट जाता है, तब मालूम पड़ता है कि coming back is such a problem.
No, golden words, Namrata, what you said, very, very important stuff that you said. You don't have to really work out so heavily and intense so that you feel that you've done great job lifting heavy weights, putting a lot of strain on your spine, on your back, on your muscles, every which way. Because the feel-good factor suddenly comes because you see all those gym workouts and people lifting heavy weights, what is seen in the movies. So people are generally saying that this is the way to go, but that's not. Tell me, how true is it that 80% of your losing weight comes from nutrition and maybe 10 to 15% comes from exercise? How true? Is it true or not?
Very true. Like
Very
they
true.
say, abs are made in the kitchen, if that's your goal.
Abs are made in the kitchen.
Yeah.
Fantastic.
So it is very, very important. You have to take care of your nutrition. People often think that, okay, I've eaten gulab jamun tonight, so tomorrow I will work out for half an hour extra and I will burn it. But you cannot out-exercise a bad diet. And like we said earlier, it's not just important in terms of, losing weight, because eating that gulab jamun isn't just about the calorie intake. It's also the sugar intake. It's also the other factors and the other things it's doing to your body internally, not just externally. So that is kind of the right balance you have to find. Exercising, of course, is great in terms of course, getting a great body, in terms of muscle tone, in terms of living a healthier life. But if you're talking about just weight loss and all of that, diet is also important. And just to be healthy, food intake, exercise, rest, recovery, and sleep, all these things are very, very important. None of them should be ignored, which is unfortunate that a lot of people ignore recovery time because we feel so guilty. Like you said, exercise addiction, that's also a bad thing, because any kind of addiction is bad. You feel like I've missed a day of my workout and you're like, oh my God, you're panicking. But it's really not the end of the world, because it is important to rest and recover. In fact, it is recommended by ACE, which is one of the schools of exercise, that you should rest at least once in 7 to 10 days, at least, like minimum, if you're doing moderate exercise. And if you were doing more intense forms of exercise, you would need that much more rest. More intense doesn't mean today intense, tomorrow intense, day after intense. If you've done a crazy workout today, you probably need rest tomorrow.
Maybe 2 days. You don't know, maybe 2 days.
Yeah, maybe 2 days of
48
rest.
hours, maybe 72 hours.
You need to listen to your body. You need to give it time to recover. And actually, when you recover is when your body actually gets healthier and develops. Like you said, when you're doing extreme exercise, your immunity might actually be suppressed. Your muscle fibers are actually torn when you exercise. And only when you rest and recover will those muscle fibers build back, get stronger, and will you actually reap the benefits of exercise.
And also due to these such extreme exercises, so much of muscle tear, I think doctor will agree with me that there can be, in rare cases, rhabdomyolysis. Now, rhabdomyolysis, if detected early, is fine, but if it isn't, it can cause really a bad news for you guys.
Yeah, and even in terms of a marathon, we were talking about it earlier. There was a study that showed that marathon runners, even after, like a day after running the marathon, have found biomarkers in their in the blood sample that indicate heart damage. But these biomarkers could go away within a day or two. But now if you're doing it repeatedly, if you're going to put yourself through that extreme exercise over and over and over again, there have been cases that, of course, we know about cardiac arrest, we know about, physical changes happening, which can be extremely dangerous.
True. Very true.
Very important. So, I loved your statement when you said that you should rest more. I love that. I should be resting more. But after a good workout, how would that little sweet pain after a good workout? You feel good. The muscles are a little achy. They are good. So should that ache disappear? Is that what you are mentioning? Is that's when you start the next exercise?
Yeah, definitely. I mean, there are many different schools of thoughts, of course. Some people tend to work just the upper body and say, okay, now this part is sore, so now I'm going to work that. But, it really depends. There's, first of all, understanding the difference between good pain and bad pain. So understanding that difference, understanding when to stop, all these things are very important, which is why we always say it's a good idea to work out with somebody who's educated, with a physical trainer or a, practitioner, guide who can take you through the exercise regime, because they can help you understand your body better, especially if you're just starting off, because you may not know how much is enough or how much to push yourself initially, because you've not done it before, and that's absolutely fine.
So if I may add just 1 second, we have had many of our clients or members who come to us and who have trained 5, 6 days, 7 days a week, because mentally they feel, oh my God, anxious, I haven't trained today. But in majority of the cases, we have managed to get them down to training much less, and they feel so much better.
And getting better benefits.
Yeah, and they're getting better benefits.
What is the ideal balance, Samir? Should it be 3 days a week, 4 days a week? What is the ideal balance?
But I will tell you one thing. Again, as I said, it's very, very individualistic.
Yeah.
But anything between 3 to 5 days a week is a good workout, depending. Now, it can't be 5 days of crazy workout. It can be 5 days, yes, in which you can do 2 or 3 days of a reasonable, moderate to vigorous, but the other 2 days should be more like an active rest, more of a recovery kind of a workout, So it depends. But if you ask me, how much do I train? I personally never train more than 3 days a week. My timing per training cycle is about 30 minutes. I never train more than that.
Wow. 3 days a week, 30 minutes is what a senior trainer like you is saying. You are too fit. Samir, how young are you actually? 36 or 37?
Well, you could say if you ask me how young I am, I'm 36. But if you ask me how old I am, I'm 63.
Oh, I was not bad. So so, my God, the amount of exercises that you can take care in your core and the strengthening which you have, the skin glowing both daughter and father.
Thank you.
So thrice to 4 times a week, half an hour, 40 minutes, you really don't have to struggle and die hard to keep exercising, lift heavy weights and, put those muscle weights. You don't have to take too much of protein supplements. Am I right?
Yes. But one thing is there. When you train, you must be, every rep should be 100% effort. That's important. If I'm going to sit down and socialize with things then they'll want an hour and a half.
No, and also like you said, 100% effort, being focused on what you're doing. What happens is a lot of times when you're working out, you're also talking to someone, you're also doing this, you're also doing that. The idea is workout or that exercise should be your space. You should be 100% present there, because also thinking about the muscle that you're working can make a whole world of a difference.
Very, very interesting what you're saying. The relation between the body, mind and soul.
Sorry, one last thing. Yes, of course, mind and soul, as mind and body, as you said. But always remember one thing. We as fitness experts, so-called, do not know everything. So in case if somebody comes to us with a heart issue or with a knee issue, etc., we may know how to correct it, but it's not in our purview to guide them. The guidance has to come from doctors. Like, for example, we have people with cardiac issues, we have people with knee issues, etc. But we are very much in touch with the doctors to say, okay, what is the maximum heart rate at which we should train? Or what are the certain exercises that we should not do? We always talk about contraindications. It's very important.
Samir, one of the studies said that, guys tend to work out much more better when more repetition. There are some smart girls around in the gym also. So there should not be enough distraction. You've got to concentrate on your muscle.
Well, I don't see them. I only work out when I do.
Which means you have to concentrate on every muscle, give it 100%. Very important. Those 30 to 40 minutes which you are there, just concentrate on that with your core and the muscle aligned, exactly working out. That is
Slow
a very
reps.
important. Yeah.
And slow reps. Always remember, whatever exercise you do, slow. It's not about how fast you train.
And breathe.
And breathe, of course, and breathe.
The right kind of breathing, exhaling and inhaling the right way.
Yes.
Great. Akshay, now coming to you.
Yeah.
What exactly is the difference between a heart attack and a cardiac arrest for a common man?
Yeah, I think this is extremely important point that you brought out, because the difference between the two, it is so important to know, because it tells you how to respond to each condition. Heart attack is, if you talk in simple terms, is chest pain. And that chest pain comes because of a block in one of the arteries supplying blood to a particular, some portion of the heart muscle, which starts dying. That heart muscle gets damaged, and that damage translates into chest pain. And the important thing is to open that artery. So now to open that artery, it cannot be done at home. It has to be in the hospital. So the dictum in heart attack, that means a person having a chest pain, which is lasting more than a few minutes, which is unusual. And it is right at the center of the chest or either side of the chest, radiating to the jaw or back or shoulders or arms. When you have such a symptom, the most important thing is to go to the nearest hospital, confirm with a cardiogram or some blood tests, and start treatment. And while going to the hospital, take a chewable aspirin, chew it in your mouth, if you have it at home, which is very important, and go to the hospital as fast as possible. Because the faster you go, there are two things that are advantageous. One is, while going to the hospital, or the first 1 hour of the heart attack, after a heart attack, is the time when some cardiac arrest, if they are going to occur, can occur. So if you have reached a hospital within 1 hour, and if cardiac arrest is occurring in the hospital, it is very easy to treat and you can be revived. But then the second most important reason to reach the hospital is that the earlier the artery which has been blocked is opened, either with a drug or with angioplasty, lesser will be the damage to your heart muscle. So these are the two reasons why reaching a hospital is very important in heart attack. Whereas in a cardiac arrest, what happens is the person just collapses and stops breathing. And people are scared. People are worried. What happened suddenly? The mind stops thinking. And the first thing people feel is rush the patient to the hospital. And that step literally kills the patient totally. Because unless the hospital is 1 minute away or 2 minutes away, don't rush to the hospital first. So this is a cardiac emergency. In fact, I wrote in my book, is an emergency where rushing to the hospital is not the first priority. The first priority, thank you. Yes, thank you. So understanding, preventing, reversing, and healing coronary artery disease. That's right. So the first priority is to pump the heart so that the brain gets blood. What happens in a cardiac arrest is the heart stops beating. That is cardiac arrest. Patient has no complaint. He just stops, drops down. And the heart stops beating. And when the heart stops beating, the entire body doesn't get blood. But the brain is the one that suffers the earliest. Within 3 to 5 minutes, the brain starts getting damaged irreversibly. And in 10 minutes, if the brain doesn't get blood, it dies. So the first priority is to give blood to the brain. And that is done by pumping the chest properly. That is called CPR, or cardiopulmonary resuscitation, which can be learned. And that keeps the brain alive for some time till the heart can be revived. So the next step is to revive the heart with the help of a machine called a shock machine, or a AED, automated external defibrillator, which a lay person can use it. And in Mumbai, in the last 1 year or 2 years, lives have been saved on the roadside, in clubs, by using this AED machine by lay people, not by doctors. A doctor is not required to revive a heart when on the roadside. Anybody can become a savior for such a person if he knows how to recognize cardiac arrest, how to give CPR, and how to use the AED machine. And of course, AED machine availability has to be there. So cardiac arrest has to be treated on the spot. So that is why we want to differentiate between what is cardiac arrest and what is a heart attack. Heart attack, chest pain, rush to the hospital. Cardiac arrest, suddenly dropping dead, stopping breathing, and treatment on the spot. Of course, you call for help, but the treatment starts right away. So that difference has to be.
That is the golden hour that you're talking about, Akshay. Now, what you said is the golden hour.
Yes.
Don't wait, don't panic, don't wait for your GP. If you start getting a cardiac pain and you're getting chest pain, it could be pain in the throat, it could be in your hands, it could be, like Gujubais have a lot of gas problem.
Yes.
And quite often, God gives you premonition in most diseases. It is we who don't understand that.
Right.
So if you have a gassy feeling for a couple of days or something of that kind, don't just take antacids. Don't think it's only gas. If you have constriction in the throat, you have pain in the back, you have pain in your hands. Of course, classical is the chest. At the most, what? ECG will be normal. But go to the nearest hospital. Try not to walk. Let somebody put you in a wheelchair, drive as fast as you can to the nearest hospital. In that golden hour, if you reach, however bad the traffic is, don't worry about which hospital. Go to a nearest emergency center and get yourself fixed at that point in time. And that's the first thing. Am I right, Akshay?
Absolutely.
Rather than waiting for a doctor to come home or, insisting on a general practitioner, the first thing is to see that you get immediate access to help.
Absolutely. Correct.
And
very true.
Every gym should be having that machine which should help, and they should be trained to see that patients are taken care of in case of sudden cardiac problems right there in the gym.
Right. True. Very true. I think so. I think all over the country, all gyms should have training programs for resuscitating cardiac arrest victims and the use of AED machine, and every gym should have AED machine. I think we are seeing far too many gym deaths of young productive people.
Yeah, so we will have a separate session on how to use the AED machine.
Right.
I had that in the past. I think every single person listening to this, with the modern machine which is available, you don't really have to become a doctor.
Right.
Anybody can use it. It gives prompt commands. It tells you what is the next thing to do, where is the lead to be attached. You don't have to worry about giving a shock. It automatically gives the shock. And that's the beauty of the modern machines, and a lot of lives can be saved.
Absolutely. Very true.
Now that we are talking of exercises, Akshay, if you have a heart problem and if you should be exercising despite that, because you want to reverse those blockages. Correct. So diet control and exercise. How much is enough, and what kind of exercises would you recommend for them?
Yeah, so it depends on the baseline heart disease that a person has. From one extreme, a very unstable patient with heart failure, not corrected, absolutely no exercise, maybe just rest at home should be important. On the other extreme, people in whom they've recovered after an angioplasty or a bypass surgery, heart functioning is good. They've gone through the rehab process. Now, I always advise patients who have undergone angioplasty, bypass surgery, should undergo at least a 6 weeks or 2 months rehab, formal rehab training. And once that is done, they can do the moderate regular exercise that we were talking about. Start slow and pick up and do exercise 5 to 6 times a week, like a brisk walk or a slow cycling or slow swimming. That can be done for such patients who are stabilized, who are on proper medications, who are followed up by their doctors properly. Such patients can do regular moderate exercise. There are patients in whom we have done angioplasty and they have done marathons. That is extreme. They've been tested time and again, and they have been found very fit from the cardiac point of view, and they can do that also. But for most patients after having heart disease, after a proper checkup and screening, just start slow, as Samir said just now. Start slow, pick up your intensity slowly, and go to a moderate level, but be regular. Regularity is very important.
So consistency, persistence, regularity, not overdoing it, and enough rest is an adequate thing that which should be done.
Yeah. One more thing to add, that sleep is extremely important, because we have found many people sleeping less and exercising too much. What happens is, when you sleep less, there are some chemicals like cytokines that are secreted.
Yes.
And as the immunity also goes down, cytokines are secreted. They promote plaque rupture and heart attacks. So sleeping well is extremely important.
So resting adequately after a good workout. One of the things that in the urban lifestyle that I consistently see with people, 8-10 hours of office work, 2-3 hours of traveling, and then of course social media catch up, and then to relax and entertain, you have Netflix, or you have what's going on in the world, you have news catch up. As a result of which, the standard sleeping time in Bombay has become 12 o'clock, 1 o'clock, and to get up at 7 o'clock. So 6 hours of rest is definitely not adequate. And rest would be one of the most important healing factor.
Yeah.
You may not exercise that heavily, but to recover in life, rest, sleep is a very vital criteria. Both our experts are saying. A cardiologist also is telling us, and the gym trainers also are telling us that rest is a very important criteria. Sleep adequately, give muscles your adequate rest. Akshay, the marathon season is coming soon, and a lot of people get inspired, which is good in a way. But tell me, who are the ones who should really take care? Because you could get sudden cardiac problems with marathon, and people don't realize they're pushing. As usual, you have to push yourself. Nothing happens by itself.
Right.
So what is that Lakshman Rekha that people should be careful of with the marathon season that you would recommend?
A very, very important question. Marathons are going to come now, Jan, Feb. I think the first thing is, who has a family history of heart disease, especially a family member before the age of male family member before the age of 55, or a female family member before the age of 65, or even any age. If a family history of heart disease is there, then you have to be more careful. And then, of course, do all your blood tests. If you are about, it was said above 40, but now I think I would say if you're about 25 and want to run a marathon, get a proper checkup done. Get your blood pressure checked, your sugar checked, your cholesterol checked. But you may be having congenitally very high cholesterol levels and nobody knows. So get your things checked up, and get certain extra checks also can be done for people who are at a little higher risk, like having hypertension or diabetes. Maybe they should get their some extra blood tests done, like high sensitivity troponins, or calcium scoring of the heart arteries, or even, as I said earlier, CT angiograms. So the most important thing is, go to your cardiologist and let him decide, and discuss with him what are the best tests that you have to do, and to what level you should go for testing. There may be somebody who may not require any test, but there may be somebody who may require a lot of tests, including CT angiogram. So best is to have a discussion with your doctor and then get things done.
Classical case, I'll tell you, Akshay, is a dear friend of mine who's a solicitor, hypertensive, and he's got interested in running a marathon. His blood pressure shoots up.
Right.
Now, I would be worried for a friend of mine. He has to do it. He has to exercise. But at the same time, if he suddenly pushes himself,
right,
are we now suddenly tilting the tables? What would you recommend to this particular group? They know that they are a little unfit. They want to get fit. They are very enthused about it. But when is it that what's the tipping point for them?
Yeah, so I think anybody who is like that with hypertension, whatever, I think all the blood tests that are required should be done. They should undergo a stress test. See not only the cardiogram on the stress test, but also see their blood pressure response during the stress test, so that one can modulate their drugs properly. One can give better drugs, timing of the drugs, all that has to be better. Then, of course, the preventive drugs that can be given. For example, if you have multiple risk factors, maybe a statin or a cholesterol-lowering drug would be a good preventive therapy. So I think these are the things that should be done. And he should, of course, start slow, go on a moderate level of exercise. And if he wants to do a marathon, and if he has risk factors, I think a CT angiogram may also be required.
Akshay, the latest thing, I spoke about reversing diabetes last time.
Right.
Tell me, is there something more that we can hear, some good news on the heart front? Can you reverse heart disease? The arteriolar obstruction, and you have the plaques, and you have the...
Yes. I think first time this was shown by Dr. Dean Ornish some 30 years ago. And people were skeptical about it. Nobody thought that the blockages could be reversed. And he actually showed with just diet, exercise, meditation, yoga, group support, and he called it Opening Your Heart program. And he showed conclusively that blockages could be reduced. May not be completely reversed, doesn't mean completely gone. For a 90% block could become 85%, but that is itself a big achievement. Or stabilization of those blockages, that it's a big achievement. Now, with the advent of statin drugs, it adds to our armamentarium, and we are still better off in reversing coronary disease. So a stable coronary disease can be reversed if all these factors are looked at: the mind and the body, the diet, the exercise, the group support, yoga, meditation, Pilates.
Akshay, what is the normal cholesterol level? A lot of things have been written about in the last couple of years on cholesterol.
Yeah. So
majority of the cholesterol is formed in the liver,
correct,
not just your dietary habit. The yellow of the
correct,
egg was always blamed for it.
Right. So the normal cholesterol level there is different for different people. So we don't use the word normal. We use the word what is desirable. What is desirable for you may not be desirable for me. For example, if I have already had a heart attack, or my angioplasty has been done, or I've done bypass surgery, then my LDL cholesterol has to be as low as 50. Whereas supposing you are a young person of 25 without any risk factors and maintaining a good exercise regime, a good diet, your LDL cholesterol could be 130 or 140, it doesn't matter. So we talk about what is desirable cholesterol. So one may have a different level and the other person may be a different. But usually I think between 70 and 100 should be for an average Indian.
No, the good old levels of 220, the total cholesterol of 220, 180, what is that cutout factor? Like sugar, we are saying 180 is okay now. What is it? HbA1c, or like that, you have a cutout factor for cholesterol that has been modified, revised?
Yeah, nowadays we have stopped looking at the total cholesterol level much. We look more at the LDL cholesterol level, the so-called bad cholesterol. And that LDL should be less than 100.
Okay.
And as I said, for high-risk people, it should be less than 55.
Okay. Samir, now asking you about the marathon runners, should you be training your muscles also? Is it because they are into extreme cardio? It's just pure cardio. So should they be also developing their muscles? Should they be doing strength training? And what is your advice to people who are going to be going for marathons?
I mean, I think it's a must to do strength training. I mean, irrespective of whether you're doing a marathon or not.
I would say, in fact, more so
More
if you're
so.
doing a marathon, because you're putting so much impact on your joints, with your ankle, knee, hip, back, everything is going through so much pressure and work that you actually need more muscle maintenance, more muscle repair, more stabilization of the joints, and working on even the deeper muscles of the body so that you can prevent injuries from happening. So I would say, in fact, for somebody planning to run a marathon, I would say Pilates is the most important thing for them. And I genuinely mean it, because the amount of injuries we see through it, and even if not injuries, someone will come back with a backache. It might not be an extreme injury, or they'll just be like, my knee feels a bit weird, or they'll come back with a swollen knee, So working on those stabilizing muscles and really helping you cushion those joints is very, very important. And so I would say, yes, even more important to work your muscles if you're going to run a marathon. You can't just think marathon means let's just keep running every day.
And what they don't realize is that, when they run, they think they're really working their legs a lot. I mean, they feel, wow, my legs are strong, or my glutes are strong, or my shins. More often than not, because of wear and tear, in fact, they are the weakest. So they definitely need to do, Pilates, yes, of course, but also strength
And
training.
also you run through the powerhouse, the core of your body. A lot of times, the thing that will take you further or help you get through is when you have a strong core, because that is the center and that is the powerhouse of the body. So, you have to realize that you need to work that as well. And even runners would know that they are using their arms also. It's the entire body that's working. So it is important to work, muscle train the entire body.
So from my experience of Pilates in the past months, Amir, I must tell you that the amount of core strengthening, we heard about core strengthening, used to do abs, used to do many other things in life, but the core strengthening, the glutes, the thighs, the back, and the core, the way it is done and what you're saying, that is the core which has to be taken care of ultimately, even while jogging and running. That's the one which is going to give you the push and not have any injuries. Because finally, for any kind of exercise or jogging, you have just a few things to depend on: the bone, the muscles, and the ligament. That's it. All three are capable of injuries badly. For all those footballers you see and the cricketers you see surviving and making billions of dollars, I see so many of them injured and having lost their careers in that.
Sure.
And what's really sad, if I may add, is that these cricketers and these football players, they perform extreme exercises. They end up injured more in the gym than on the field.
Is it?
Yes, a lot of times
yes.
They end up injured more in the gym than on the field. And then their careers could be ruined. Maybe they manage it, but a lot of times you will never be 100% after an extreme injury, And so it's so important to make sure that even when you exercise right. It is so, so important. And the whole idea, like we said earlier, of more is better or lifting heavier is the goal. Why does a cricket player need to do a deadlift of 100 or 150 kilos? What is the purpose?
Exactly. What is the purpose? Come on.
There has to be some understanding of it. Yes, work the muscle, definitely. But you don't need to do that. I know some people who are putting, 100 kilos on their back and doing calf raises.
They come to us, so we know.
Yeah. And then you put them on the reformer and you make them do calf raises with simple resistance and body weight. But because they're working so correctly and, working on their posture, anatomy, suddenly they realize that they've never fired an entire muscle in their calf, because the calf actually has two muscles and not just one, major muscle that works. Yeah. So it's just so much education that needs to still go in, and people need to understand that, okay, I'm not saying don't do lift heavy. If that's what you enjoy, please by all means do it, but then balance it out. Make sure you've given the body the support it requires to be able to lift that kind of weight.
That's right.
So very, very, very important stuff that is being talked about. When I go to the gym, I choose a trainer after a lot of so-called whatever it is that and if I trust him blindly, it's like going to a doctor. You trust that doctor and he has to take the correct decision for you. What is right, what is wrong, like a cardiologist, if Akshay is saying. But the same way, the gym trainer, if he himself is not aware of a lot of things in life, and he is only hell-bent on training you because he's seen that heavy workout and this, if your posture, if your form is not correct, if you're not in the right shape, and you're doing excessive, like you said, doing deadlift with 100 kg, or lifting heavy weights and doing your squats with something on the shoulder, big time injuries. So there has to be a great coordination. Be very wise on whom you choose as a doctor. Always do your homework.
Yeah, always. Very important.
Be very wise in choosing a lawyer. Of course, yes, no question about it.
No question.
And for your own body, of course, dietitian. No, again, all those punks which they say in the newspapers that lose 8 kgs without dieting, don't listen to any nonsense.
Don't do it.
Anything which sounds ridiculous is ridiculous. Like in the finance world, what they say is very simple, clear cut. If it looks like a Ponzi scheme, if they're trying to pay you 30, 40, 50%, it's a Ponzi scheme. Don't listen to it. You will be taken for a ride. So also it comes to training your body. Be very, very, very conscious about whom you are training with. Be clear. And it's a everyday process of evolution of training your heart, your body, your mind. You have to learn with the trainer. You have to be one with them, and you have to keep reading what suits you the most. Your
Very true.
cardiologist may not be knowing a lot of things about you. Your trainer may not know a lot about you.
Sure.
But you in the mirror, that's why the name is Mirror Wisdom Reflected. The channel name's good. That you, the naked truth is you in the mirror. Learn from everybody, listen to everyone, but suits your body language, your body will tell you. There is a premonition to a heart attack. There is a premonition to gastritis. There's a premonition to breaking some bones, muscles. You will get it. An aura before a migraine, an aura before a seizure. Body gives you time. Even your sugar when it goes down, hypoglycemia or a vasovagal attack, you will get a fraction of a second. You will get that understanding. Listen to your body very carefully. And that's something very important. So before I wind up, what are the real side effects of high intensity excessive workout? Now that we are talking about workout, besides the heart attack, which we talked about.
You're asking me or doctor?
Yes. No, I'm asking you, Samir.
Okay. So what basically we say, of course, one of them is huge joint issues. That's one thing which can really happen. There was this. Yeah,
sorry.
please. No, please
also, overtraining can actually lead to more storage of fat. So people think that if I exercise more or work out harder, I'm going to end up losing more weight or in any of that. But you can actually end up increasing body fat by overtraining, which is also very harmful.
Also, there's a drop in immunity levels. And these people who normally do extreme workouts definitely have a much lower carb intake. Very, very low carb intakes. And that really is not a great sign either, because it compromises the immunity. Also, there was a study done by John W. Brick, the hospital in UK, regarding mental health. And they very clearly said that exercise is a must, which we all know. But they very clearly said that excessive exercise or extreme exercise actually harms. It causes depression and anxiety.
And worsens mood on a day-to-day basis, all those kinds of things. And you can lead to chronic fatigue.
Exactly. So, I know somebody who did 500 squats in one of the classes or whatever, did 200 burpees. Who trains like that? Why? What is the reason for that? And she's training with me with the L4, L5 busted. Her body, every part of her body is under severe pain. Probably, I would say she just got saved from rhabdomyolysis.
Wow. We all have a masochistic and a narcissistic view of life. And at times, the more we suffer, no pain, no gain. So you just feel at times that it's the greatest thing in life that we are having.
No, fortunately, unfortunately, we've got only one body.
That's it.
So you have to make the most of it, treat it right, because that's the only thing that's going to stay with you literally for the rest of your life.
Namu, I'm going to ask you, you have some lovely fit people with you, some absolutely hep body people, people in the industry who really work hard because it's their body which is important to them. How do you make them fit and how are they remaining fit? If I had to ask you, the perfect figure which the whole Bombay Time dreams of, the whole world dreams of, and that's why they keep running. So tell me, what is the secret behind that?
Honestly, it's just about being regular. It's just regular work, understanding their bodies. And of course, because they know that they, have to look a certain way, whether it's for their role, whether it's just because they want to. The most important thing is being regular, being disciplined, and not overdoing it. So the constant battle that I have, because sometimes what happens is with a lot of, celebrities, they have shoot in like a week. And suddenly they're like, oh my God, I have to do everything in a week and achieve a goal in like just a week because this shoot has come up. You kind of have to sit them down and be like, doing 2 and 3 hours a day is not going to get you there. It's still a lot of education, lot of unlearning, relearning that we have to constantly do, because it's just engraved, I think, in all of us. Sometimes you feel like if I do 100 ab crunches today, my abs will be flat tomorrow.
It doesn't
work like that. So we have to kind of constantly educate them. But the good part is that they always want to learn. They always want to do better for themselves, also because they do have extreme shooting hours. They, know that they are putting themselves through a lot of stress, a lot of times, sleeping at odd hours, waking up at odd hours. So then they, in fact, do everything they can to ensure that all the other aspects are taken care of. So they'll work out smart, they'll eat right, eat at the right hours, and they try their best to get enough sleep as well, because they know how important it is, not only for their body, for their mind, for their skin, for their hair, for their nails, everything. So, in fact, I would say they're great students because they're extremely motivated, extremely focused, and really disciplined. And you don't have to actually get after them. They themselves, want to do it.
Thanks. Samir, any few words before we end?
Well, yeah, actually, I don't know whether I'm going to stick my neck out and say this, but I just hope it doesn't backfire. But I really would love it if, one day we have people from the celebrities or from the glam industry come out and really talk about it's not a must to do 5,000 sit-ups or 5,000 ab crunches or 2,000, because they are the people who really can educate, can help the masses, because the masses tend to follow them. So however much you, me, Dr. Mehta may say whatever it does, but eventually it really should come out from them. I know they have to go through.
Would you be able to get one of your celebrity clients, one or two of them, so that can endorse? It'll become very important and interesting for people because they listen to that.
I don't know about that, but I think in the long run, you see so many of them also with photographs in Bombay Times or photographs in some other newspaper, Hindustan Times, etc., etc. I just wish they would say, no, it's hazardous also. I mean, it does take a lot of work to do, and let's play it safe. It's not for everybody. This is what the profession demands.
Sometimes I joke with them, not touch wood, my clients are amazing, but like we laugh sometimes saying that, they get paid to look a certain way.
Absolutely.
And they have timelines that they have to reach. So sometimes they do put their bodies through extreme exercises or extreme, diets, which a normal person like all of us, we don't require that. We do not get paid to ruin our body.
Absolutely.
So,
it's amazing how Christian Bale, I've seen him putting on weight in Vice movie, where he becomes the vice president.
Yes.
And then he has to lose weight for the next Batman.
Yeah.
It's amazing how they can abuse their body.
Amazing. No, it's incredible what they do, but that's what we keep joking about, that they get.
I think it should be dangerous. It would be dangerous in the long run. Akshay, you have the last word. Tell me, as a cardiologist, suddenly putting weight, losing weight, extremes of exercises. Please guide us. Where do we stand? Where are we? And what should we be doing routinely as normal human beings to carry on with good life, quality of life?
Yeah, I think moderation is the key.
Absolutely.
As far as heart is concerned.
Absolutely.
And I think always choose a middle way. Don't go to extremes. Don't do yo-yo things up and down. No need at all. And life is beautiful. The way we go about it. And I think a proper diet, a sensible form of exercise, which includes strength training, core muscles, and things like Pilates, yoga, and extremely good, with combining with regular moderate aerobic exercise like walking, cycling, etc. I think a proper balance, if maintained, should do us very good in the long run, I think.
Thank you, all the experts. Thank you, Dr. Akshay Mehta, for sharing your cardiac viewpoint. Lovely book that you have, Romancing the Heart. It is very informative for a common man. We will get you back, that in case if somebody has a heart attack and if you have the machine available for you, how can you use it? It's very simple, but every person, I think, right from school, should know exactly what to do. And then the advantage, one of your own family members will need it one day. Forget anybody else. And you will be able to save somebody in your family, in your society, in your club, wherever. Thanks very much. We will come back to you on that, and wonderful inputs on that. Thanks, Samir and Namrata, for sparing valuable time Sunday morning, training your clients in between your workouts. And the glow is absolutely too good. The pink and white glow that you guys are throwing up. The happiness and great. All the very best.
Great.
Friends, I hope you had some good understanding and insight into exercising, over-exercising, under-exercising, how your heart health matters every which way, the importance of rest, the importance of diet. Each one of them are parameters, one tilted, and you can follow up. It's like the juggler. You are constantly juggling between 5-6 balls in life. It's rest, diet, work, exercise, mental, physical, spiritual rest. All growth in every field. It's a phenomenal opportunity given in this lifetime to keep learning. And as science evolves, as you know, we earlier used to say diabetes and heart problems could not be reversed. We are ready to change. If there is evidence-based medicine, we are ready to say that, yes, there is something which can change that. And that's the beauty about modern science. Thanks very much for being with part with the whole show. Hope it was some improvement insight into what has to be done in life. Thanks, Dr. Akshay Mehta. Thanks, Samir and Namrata. Thanks for being on the show.